Well, the world is changing. We know it's coming. It's like two trains heading at each other going down the track, and we hope they're not on the same track. We know that according to medical economics, 32 million people are about to be insured. They're going to be new patients. These are people right now that are showing up in emergency rooms. They're accessing health care in some way, but usually at the end of their health and not at the beginning. And how are we going to do this? Well, this last year, Jack Bragg has spent tireless times in healthcare transformation. He has worked hard. He knew it was coming. He said last year it's coming, and by God, he's been able to transform himself in 1 year. So what does all this mean? I mean, it's really about the desire to provide improved health care, improved quality that's affordable. And we all know it's gotten ridiculous, the cost of everything that we do. And how can we do this? We have tools to make this happen. It's through scientific and technological discovery, things that we can do and things that have been provided for us as tools. We have patient needs. They're in the middle of all this. It's their needs that we're trying to serve. And of course, there's market forces that drive this. There's a competitive margin that's out there. It's an important part of all this. But through all this, we have to kind of redefine what is excellence. We all feel like we practice excellence. We do this on our day-to-day patient activity. But now we're looking at excellence kind of being redefined in the new healthcare law by clinical outcomes. How are we doing? How do we do it compared to each other? How do we do between ourselves? What's our interpersonal relationships like? How well do we work together in teams? How well do we make the whole system work? We've seen multiple lectures during this convention talk about our dysfunction and how we just, don't get together well. And at the end of the day, it's all about the experience of our patients. How satisfied are they with not just us, but the whole healthcare environment? So where's the money? How's all this money? How are we going to pay for all this? And that's the trillion-dollar question. Well, 10% of the population consumes about 2/3 of all our healthcare costs. We all know that. And where's that from? It's all from chronic disease. We spend most of our money in healthcare at the end of our lives. And that's something that we can maybe make some influence on. From what Michael just talked about, obesity being one of those major factors. So about 1/5 of our healthcare costs, according to the Institute of Medicine, are potentially avoidable. And we've seen during this convention data presented that really shows it's more than that. But just from complications, it's a $40 billion deal. Billions of dollars out there that we can do better at. What's our role? Our role as physicians. Well, most importantly, we can lead this process. It's not done yet. There's a law. It's 2,000 pages. But now we're in the process of writing those processes that make it work. Who knows how many pages that's going to turn out to be? Who knows what an election is going to, how that's going to change things. But at the end of the day, it's our leadership that makes a difference. Physicians are still in control if we want to be. If we're not, somebody else will fill that void. It might be suits, it might be nurse practitioners, it might be physician assistants, it might be somebody else who steps up and takes the role. But right now, it's our game to lose. We can redesign this healthcare delivery system, not the payment stuff that seems to be concentrated on, but the actual redesign of how we can best take care of our patients. With that, secondarily, becomes payment reform. How do we best take care of the patients? It's the form and function thing. We can facilitate better care delivery if we can design it first and then facilitate how we get it paid for. Well, in 2008, your board had a retreat and some ideas were established, were discovered. I'm sorry I didn't bring my hat this morning, it didn't fit. But an idea was born, and that is the future of medicine was envisioned. It really was about healthcare delivery. A concept of what the osteopathic internist can do, and really far different than our traditional patient care that we deliver today. The values were placed upon the patient and the patient-centered approach to healthcare. The team. And I don't mean the team between us and the cardiovascular surgeon and the cardiologist and the other ologist out there, but I'm talking about our team. The receptionist, the medical assistant, the nurse practitioner, the physician assistant, and our colleagues in general. How do we best well-oil this team? The physicians are the one who leads the team at the unit. At the end of the day, it's just like our bodies. It all happens in the cells. It all happens in the cells. So, what is all this? Well, one was providing open access. Taking care of the patient's needs at the time that they need them. That's how they feel secure. That's how they're timely evaluated and treated. So much of what we could do if we knew that our patients needed us, because it gets blocked by the wall at the front desk, or it gets blocked by other barriers we have to access us. If we could see them, at least our team could see them, it'd keep them out of the emergency room. We're all impressed by the number of emergency room visits and urgent care systems and minute clinics. It's all a sign of our failure in our healthcare system to take care of our patients properly. And we all have gotten these reports to these multi-thousand-dollar workups that you and I, if we knew our patients were there, we could stop. I mean, we did not have 15 CT scans. We did taking care of them. Population health care. How do we best look at our patients and know that we have done a good idea? Have we really set back and look, am I doing good? Am I doing good compared to my colleagues? Could I do better? So if we don't have data, we don't know that. Information technology, not as an albatross, but as a tool to help us to understand it. And how do we make it best work for us in a reimbursement system? Because we can do better from our reimbursement and our compensation standpoint if we knew how to best make use of this and wasn't fighting it. And then finally, chronic disease management, because that's where the money's at. How do we use technology and techniques, whether it's shared medical appointments? That's a technique that we use with diabetes, that maybe take 9 or 10 patients in and their spouses over a 90-minute period to have a very thorough examination, and to do that on a quarterly basis, and to get compensation for that. But it's a team approach where we have a dietitian, a diabetic nurse educator, and nursing staff. To utilize patient education in a better fashion. To use e-visits, electronic visits. How do we best use our computer? How do we get compensated for those thousands of phone calls that we all take that our nurses are fielding, and get compensated for that information and advice that we're giving on the telephone? And to keep the nurse off the damn telephone, working for our patients, seeing patients, touching people, rather than being telephone operators. And then most importantly, the physician leadership and communication skills. Because we don't, we spend our whole life coming up through high school to undergraduate school to medical school to residency, excelling individually. And then we get out into practice, and we got to work together. And now we're being expected to lead a team, and we haven't been trained to do that. So the leadership skills are an important part in the mature physician. Well, the federal government made an effort at this in 2010 and passed this Health Care Act. And it really seeks to improve and strengthen our primary health care system. Whether it's going to do it or not, who knows? But there are certain segments of this that are interesting. It encourages a patient-centered medical home model of care. We heard this in detail this last week. It's a team approach. It emphasizes prevention. It emphasizes chronic disease management. That's where the money's at. So the ACOI developed a plan. And you think, wouldn't it be neat if, we start our day with a huddle with our staff, and the staff keys off those patients that have concerns, or unique things about those patients. That we triage those patients so that I'm not seeing a typical hypertensive follow-up that, you know, we're going to do nothing with. Maybe that's done by another staff member, a nurse practitioner, to deal with those things. At the same time, my nurse practitioner shouldn't be taking care of an acute abdominal pain that's coming in. That's my job. That's what I've been trained to do. And so we have to meet the need to the level of our license and the level of our expertise. Through this process, we've worked hard at keeping the patient in the center of the care that deals with both specialty and primary health care. We published a paper. This paper was published by the task force of the Phoenix Physician by the ACOI board. This was published in the JAOA, and quite frankly, it's getting some traction out there. You noticed that it was noted by our ACP speaker. It was noted by by the AOA, and so we've come a long way with this. And I think it's an important part of where we're going to the future. The ACOI developed some training processes to make this work. One was in the resident curriculum, and over the last 2 years, Bob Kane, John Bolger, and the CE committee has worked hard integrating the Phoenix Physician concepts of leadership into our residency curriculum. And we got a ways to go with this. It's more than lectures. It's got to be part of what they do, of what they're trained to do. But they're working hard at this so that when these folks graduate, they'll have the tools. Population health care, using information technology and databases into our residency programs. So if they're trained, they come out and they become leaders. They fit into healthcare systems like a, hand into a glove. Team-based education. We initiated in this convention the ACOI Physician Leadership Certification Program. This program is dealing with those items that you see listed up there. It's a one-year program. It's the first of its kind. It's unique in the nation. We have a number of you who have already signed up, and we invite more of you to come. The University of Texas at Dallas has been educating physicians in management and leadership for many years. And quite frankly, the leadership of that group gets it. They understand what the future is. They understand the politics, and they understand physicians. And I would encourage any of you, no matter what your unit of service is, this is a helpful tool in helping us go forward in leading the healthcare dilemma. We have a plan of attack. It starts now. It starts at this convention. The year of the Phoenix Physician is coming before us, 2012, 2013. And we want to integrate this into your practices, to help your practices, to help you better take care of your patients and financially be able to continue to practice in a model that is beneficial to you. There's an old Indian proverb that's been repeated for generations. If you find yourself riding a dead horse, the best strategy is to dismount. It's the wise and prudent thing to do. In healthcare, though, we fix this. We have strategies. We sometimes change riders on that dead horse. We get a committee together to study the dead horse. We get more funding. We get grants to increase the dead horse performance. And we reclassify that dead horse as living impaired. We have got to think of this box differently. We've got the patients. We've got the education. We know how to do it. But we've got to develop the skills to make it happen in a team. Because there's not enough of us to take care of those 32 million people that are about to come upon us. We don't have enough of us to take care of the people we have right now. But we still have the need to take care of them as a country. So right now in this room, some of the world's finest physicians are here. You have the ability to become the Phoenix of physicians of tomorrow, to lead this whole nation into changing the delivery system and to improve the care of the people that we serve. You can continue to be your patients' heroes, to promote the vision that we have in a team of osteopathic internists to make a difference. Because surely, out of the ashes of this dead healthcare system will arise the Phoenix physician. Go get them, guys.